So we're discussing, we're rethinking the conclusions drawn from postural assessment. What conclusions? Because now that's used by many practitioners across many fields. We look at someone's posture and we draw conclusions and we try to make decisions based on those conclusions. So we want to rethink those conclusions.
Yes, or at least challenge them a little bit, right? Because when
Right.
you look at, right, the Posture Institute, which, has a certification called postureology, which bases, it's their entire interventional strategies and decision-making on how posture is observed. Rolfers look at posture and make decisions based on posture. Feldenkrais practitioners look at posture and make decisions about that.
Massage therapists, trainers.
Yanda, and his work and dynamic, neuromuscular
Physical therapists.
manipulation, right? The upper cross, lower cross idea. Physical therapists have been using posture assessment and observations to make.
And it's a fair thing to use.
It is an observation, absolutely. I mean, if you're looking at the human condition, the subject, and trying to make sense of what's going on with them from a movement perspective, from a health perspective. So we'll look at posture assessment or posture observation as a component of some practitioner's choice to get a sense of health. One set of variables, one set of observations that give some insight into their client's, patient's health. So, right, something about their health, right? And what do you think that is? I mean, generally speaking, what's a Rolfer? What's a posturologist? What's a Feldenkrais practitioner? What's a PT? What's a trainer? They're looking at posture, and what do you think they're doing it for?
They're probably measuring it against some ideal, and they're trying to see how far away from this ideal is someone, because I believe think that the further they are, their goal is to get them back to that ideal starting point.
Right. And that ideal, how is that ideal determined, or that normative, right? Because, from a general sense, posture just means the relative disposition of the parts of something, the position of the limbs or the carriage of the body as a whole, in space and in time. Okay. I mean, that's pretty broad. And it's not saying posture is standing. Posture is supine.
Right.
Posture is any relative orientation. Now, I would say, looking at just briefly, looking at Feldenkrais postureology, Rolfing, what PTs do, what trainers do, what we do, we're looking at it standing. Seems like everybody's looking at posture primarily standing. Some will look seated, some will look supine for sure. Never seen anybody do an analysis of posture with someone standing on their head, right? Or lying on their side, or lying in the fetal position.
Or just leaning to the side.
Yeah, or
lying backwards.
Yeah, or kneeling, right? Or
kneeling.
Yeah, so there's clearly a bias to kind of the standing, seated, supine thing, apparently. And
walking, right? The moving posture, walking, the gait.
The walking gait, yep. So dynamic posture, static posture. Is posture truly just static? So yeah, it's tough. I mean, I got a quote from the American Posture Institute. Defines postureology, I guess the study of posture, as the scientific study of the body's static and dynamic alignment as it stabilizes itself in space against gravity and other forces. Postureology is a science, is a method for analyzing the design of the body and how the body aligns itself in relationship to the surrounding environment. Okay. Fine. So the question is, what really can be inferred from visually looking at another person's posture under whatever kinetic conditions they're in. What can we say, right? This is the hard part. So you can see why base rates are so important, because without the base rates, what's the normative,
Right.
and how far, what's the standard deviation from that normative? And clearly, looking at someone anterior to posterior, posterior to anterior, parallel to the plane of the surface of the earth, perpendicular to their axial arrangement, which is tangential to the earth's surface, as a kind of an almost two-dimensional view from a very limited perspective. I mean, I rarely see anybody look at posture from the head down, cephalad to caudal, right? Never hardly see that. I never see somebody looking at posture through someone standing on plexiglass and looking up through their feet. You never see that. You tend to see that A to P, P to A, and medial to lateral, frontal plane viewing. And there are textbooks that have, going back to Kendall and Kendall, and talking to our friend and colleague Charlie McMillan, has been doing some great research and study and digging up some historical documents on a variety of topics related to muscle testing, and Kendall and Kendall's approach to trying to see if there was a relationship between posture and pain, which there wasn't. They couldn't find one. And so,
That may
because
be one of the conclusions we want to rethink.
Yeah, right. It's like, wait a minute, I don't know. We can't look at posture and say, because you're in this posture, that must be why you're experiencing pain or other sensations you don't like. This is very, I think, pretty sketchy thing to do. It's just too wrought with bias and the information by itself. Because what's interesting is when we look at A to P or P to A posture, and we're comparing it, to the vertical plumb, which is, gravity's vector, we're looking at bilateral symmetry, left to right side primarily. When we look at somebody from the side, well, we don't have bilateral symmetry anymore.
No.
What are we looking at now? The general, again, relative position of the whole body and its segments to that vertical, gravity vector, again, that vertical line, and where that's supposed to go. And there are books that, describe the vertical plumb falling through the, the meatus of the ear and the shoulder joint, and anterior to the malleolus and through the trochanter. There's, some idealized notion of anatomical structures relationships through the frontal plane, and through the sagittal plane viewing of kind of what structures should fall through that. Okay, fine, right? Got a reference. So now, what do we do with this, right? Why do we say, because it's interesting, when someone says, "Oh, your right shoulder's higher than your left," or your left shoulder's lower than your left or your right. Okay, so what's the problem now? Is there a problem here? Which one is not where it's supposed to be? The left one, the right one, maybe both of them are wrong, right? In terms of that intra-individual's posture. And that really becomes the major problem here, is we didn't see what they were before we looked at them the first time. So we don't have an idea about where it should be for them relative left to right. So highly problematic.
So what if we're rethinking these conclusions, what do you think the standard conclusions currently are that those people may draw that we already listed off?
Well, they tend to look at, material tensions, right? Material tone. Something's pulling more on something else. Something's not pulling or tensioned as much as something else. And clearly, we're aware that there are synovial joints and degrees of freedom that have axes where you can move, and that forces acting on these synovial joints can change the bone to bone, the joint orientations. And we know that muscles and tendons and ligaments and connective tissue and skin and all this stuff, provides intrinsic tension and compression in the body. And so, okay, so then there's these conclusions about something more facilitated, something inhibited, something tighter, something looser, right? All that.
Those are the conclusions. So I see something that's not lined up. So I'm thinking, this thing has too much tension. This doesn't have enough. Things are not orientated the way they should be. And some conclusions are they're going to blame it on the tissue tensions and try to change those tissue tensions that they're seeing in the moment.
Yeah. So some practitioners will say we got to adjust muscle tone, muscle contraction. Some practitioners say we have to adjust the fascia, the connective tissue needs a manipulate.
Some blame the bones themselves.
Some say the bones aren't right. Some get more sophisticated and there's something wrong with your visual system,
which is causing bones.
or your auditory system.
Right.
Your proprioceptive system is off, right? And so, we can lay a lot of blame on a lot of things, to try to rationalize or justify our observational claims. So
our basis for saying we need to rethink those conclusions, I would say our basis is the fact that we're acknowledging that we're dealing with a system and there's interplay going on, and we can't hang our hats on any one of those conclusions or pieces of data.
Yeah, because the vast majority of these, some you could probably quantify with some kind of linear measurements, right, against a reference. None of it's quantified. It's all qualitative, subjective observation, which is okay. But once you go into that mode of understanding that, geez, none of this is quantified. It's not precise. It's not real accurate from a measurement perspective. I'm using a normative reference, an ideal to even make my judgments against. Okay, and there's arguments about why that, and I think legitimate arguments about how far away someone is from bilateral symmetry, at least, and even their relationship of their center of mass, to their feet and weight distribution, and that center of mass is relationship to the vertical plumb and how much energy the body needs to manage all of that, versus just collapsing to the ground and staying pressed to the floor all the time, right? So, okay, these are all reasonable ways to start thinking about it. The problem is the complexity of the system's self-governance and organization, why it chooses to orient itself the way that it does under kinetic conditions. That is where you can't really make solid, absolute claims about anything you're seeing. That's where I think the problem is.
Could you just say that last sentence, that conclusion again?
The conclusion of recognizing that we're looking at this general external morphology and relative geometries against a standard of verticality, but we don't, because it's a complex interdependent system with so many degrees of freedom, how it self-governs and manages itself, why the system is choosing the posture it is based on conditions, we don't know that. We can't know that.
That's the crux of it all. There's this interplay, right? With all of these systems. Yeah.
With the general goal, like, so if it's standing posture, you know, the system is making a willful voluntary choice. I want to stay standing, and we can describe standing in a general sense in terms of where the feet are and the shin bones are and the femurs are and all that stuff. Define standing, right? And the person says, I want to stand. Okay, well, that's a willful choice. And so now they've put their mass, their body mass, and all of its segments and their independent masses, you know, in some orientation to the gravity vector, which is trying to kind of move everything towards the surface of the earth. And based on what it has available to it in terms of muscle contraction capabilities, endurance, joint range of motion, you know, clearly from a just physics perspective, if you want to stay standing, your center of mass must stay somewhere in the base of support. These are definable physics things, engineering things. How the systems, the number of choices it has available to it to do that, it's infinite. And we just don't know why it's choosing to do it the way that it's doing it, except to say, the system saying, I have to figure out how to reorient all my parts and my center of mass so it stays over my base. And I'll do that because of my own, you know, again, what people call proprioception, which tends to be a discussion about kinesthesia. I'll have to hold myself this way. And then it does it almost automatically, right? From a subconscious, unconscious way. And then to start to say, oh, the reason you're standing that way is because there's something wrong with your eye system, or the reason you're standing that way is because your hip flexors are too tight and your glutes are too weak, and the reason you're standing that way is this is ridiculous, really. You know, to make those as absolute conclusions. Now, if you want to generate a hypothesis about why someone's standing some way, and set up and run an experiment or some kind of assessment or test of that, okay. But I rarely see anyone ever do that. I've never seen anyone do that. They just make the assumption, turn it into an absolute conclusion, and start acting on it as if it's true. And that's the real problem. And even then, you know, without corroborating it against other observations or data points to see if there's any convergence of information that might move you that direction, it's a real arbitrary kind of a winging it approach for sure.
So we want to rethink these conclusions by saying, let's collect a bunch of data and hopefully try to corroborate it to then head in a direction to test a potential hypothesis.
Yep, and it becomes a matter of what data do you want to collect to corroborate it? What do you need to find out? You know, let alone how could you even confirm a little bit through corroboration the orientations you're seeing standing, for instance, in one posture, and whether they exist in another posture.
Right.
What if they change in a different posture? What if they don't change in a different posture?
So we need a methodology to do that.
Something, right? Some basic way to try to escape just the pure limited biased approach of taking one set of observational data and acting on it as if the conclusion is absolutely true, that we have to loosen the pecs and rub them, or the fascia on the front of the body and loosen it so that you now can retract your scapulas or get your scapulas bilaterally closer together, medial border to medial border, because that's normal, right? That's real sketchy in my view. So.
Yeah, no, I agree. So it's kind of the conclusion here is, how would you sum all this up? Why are we rethinking these almost single directive kind of conclusions we're drawing from a postural assessment? How do we sum this up?
Well, again, I think axiomatically, bilateral symmetry, and the closer we are as organisms to it, the literature supports in general that that's good for the system, less energetically demanding and more efficient in the way that it moves or changes position. The standing posture, I think, that's the starting position for forward ambulation, a fundamental, again, axiomatic in a way, function of the human system in order for survival, to move about its environment, right? Get water, get food. I mean, there's some first principles here, I think, that inform a reason to look at posture. But the system complexity prevents, I think, absolute conclusions being made from singular postural observations under specified conditions, and then generalizing those to, well, because you're like this standing, this is problematic for you everywhere else, right? And we have to fix it because we see it standing. I don't know. What are we fixing again? What's being fixed again? It gets back to body view, right? What people's body views, motor system, fabric, material paradigm. You're just Play-Doh and silly putty and bread dough, and you need to be kneaded and rubbed and massaged so that the fascia is loosened here and tightened there. And, it's none of which can be observed directly. None of it can be observed.
So we need a way that we use the postural assessment as a data point against other data points to help send us in a direction to test hypotheses, to see if we can make some progress.
Yeah. And recognizing that what you think you see and whatever reason you thought may not be the case, and you better be ready to abandon that.
Right.
And not force the issue, right?
Okay. So
because we can't see the inside.
Right.
So it's got to be corroborated. So that's why in the muscle system specialist course, we corroborate standing posture to supine, why we take anthropometric measurements of extremity circumference and girth, why we look at synovial joint and limb and trunk, angular displacements from start to end positions, right? Why we look at force output, history, all of it needs to be added to the picture to see if there are convergence of data points, which is corroboration, or not. So, because ultimately posture is an expression of motor control,
right?
Not just the fabric part. So,
right. All right. Well,